Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Most people probably take the sounds they hear every day for granted, but not people with hearing loss. But those folks don't have to live in a world of muffled, quieter sound. Hearing aids provide a world of clear sound and speech for many people with hearing loss. Our guest today is Dr. John Tunnell. He is a Mayo Clinic Health System audiologist. Dr. Tunnell, thanks for joining us today on Speaking of Health.
Thanks, Jason. It's my pleasure. Enjoy talking about my favorite subject.
Well, we are talking about hearing loss today and the help that hearing aids provide for folks with hearing loss. Let's begin by talking about the ear itself. How does the ear work, and how do we as humans hear sounds?
Okay. The ear is comprised of, first of all, the eardrum, which is sensitive to vibrations. And the ear can really pick up vibrations anywhere from 20 to 20,000 cycles per second. Connected to the eardrum, you have three little bones, the hammer, anvil, and the stirrup. You might remember from 8th grade science class. They connect to the cochlea, which is a fluid-filled cavity in the skull, in which there are 20,000 small hair cells, and each hair cell is a trigger that's sensitive to a vibration. So as the vibrations are spread throughout the cochlea, they trigger impulses, sends it to the brain, and the brain is what's actually hearing the sound.
So what are some common causes of hearing loss?
Two most common causes, which always come to my mind, are aging, of course, and noise exposure. Particularly in the Midwest here, a lot of farmers, a lot of people with heavy equipment, a lot of hunters and shooters. All these things, when done over periods of time, will produce hearing loss, especially if people aren't using hearing protection. And most of the farmers 20, 30, 40 years ago, hearing protection wasn't something anybody really realized they needed.
What does age and overexposure to loud noises, what does it do to the inside of the ear that's causing the hearing loss?
It affects mainly the higher frequencies. As I mentioned, the hearing range for communication is around 500 to 4,000 cycles. Well, the noise damaged hearing 3, 4, 6,000 cycles. This is where the consonants of speech are located. You know, speech has vowels, consonants. Vowels give you a sense of loudness, but the consonants give you the sense of clarity. And it's the clarity that gets damaged by noise, and it's also the same part of the ear that kind of starts to decrease with age. The most common complaint I hear is that I hear, but I don't understand what people are saying. This is because they're getting volume of speech. They know somebody's saying something, but the clarity's missing.
Is the age, the overexposure to noise, is it damaging the bones that you talked about inside, or the small hairs, or is it a combination of everything, the eardrum?
It's damaging the hair cells. They are, it's like the analogy of like grass on your lawn. If you walk across the grass, you'll see some of the grass gets bent over, but it stands up again, after a few minutes. You do that every day for a while, pretty soon they don't stand up anymore, and you got a path building there. That's what happens to the hair cells when they're overstimulated too many times. They don't recover.
So what are some common signs or symptoms of hearing loss?
Family will notice the TV suddenly getting louder than they like it. People will accuse others of mumbling. They will have to ask people to repeat frequently, and it kind of irritates other people sometimes if they're playing bridge or something. You don't want to have to keep saying the same things over again. So people will withdraw. They tend to be isolated socially when hearing loss progresses, and they become more, TV goes louder, they stay home more, and don't get out and enjoy the social activities that they once did.
So when should someone see their doctor if they're experiencing hearing loss? When should they see their doctor?
Well, if they notice trouble hearing, that should be something they should do right away. Go see their family doctor. There may be conditions in the ear, fluid in the middle ear, wax can get impacted. There's a number of medical conditions that can be treated.
And if it's not that, it could be what we were talking about earlier, and that's where, as an audiologist, you can help someone too, right?
Sure. If there's no medical treatment and the hearing loss is such that it's affecting your lifestyle and your enjoyment of activities, that's when hearing aids, that's when they become part of the discussion.
So as an audiologist, how do you test someone for hearing?
The first thing we do is what's called an audiogram. We put them in a soundproof booth, put earphones on, and they listen to tones at different frequencies, each ear separately. In addition to that, we present words. It's a list of words that are characteristic of the normal sounds of the English language that they would hear in a general conversation. So we kind of get a percentage of how clearly they're hearing. 90%, it's almost like normal. But if somebody's just hearing like 50%, we know they have a major problem understanding what's being said. So we take that into consideration when advising them about hearing aids and what they might expect. They need to have realistic expectations.
And does that testing, that all occurs right in the clinic, right?
Yes, that's the minimum basic evaluation that we do on everybody.
Okay. Well, when then should someone be given help with a hearing aid?
When we've ruled out medical aspects and they are still having problems communicating, that's when we start talking about it. And everybody's got a different level, different action level. Some people come in asking for hearing aids with just a very slight loss, and I kind of, are you sure this is what you want to do? Other people can have a severe loss, and they'll tell you, no, I'm fine, I hear everything I want to hear. And so there's everything in between. In our clinic, it's their decision. We don't twist anybody's arm and say, look, you have to do this or else, because until they get to the point where they think they need it, they won't use it. And then it's a waste of your time and their money.
So, Dr. Tunnell, how does a hearing aid work?
Hearing aid, in the most simplest form, it amplifies sound. Sound vibrations are detected by the microphone, goes to the amplifier. The amplifier feeds a little, we call it receiver, but it's actually a little mini speaker, and that's what routes the sound down the ear canal so the person can hear it. Modern hearing aids do this in a very sophisticated fashion, though. They'll do it for each individual frequency of sound, and they'll not only do it for the frequencies, but they know based on the extent of hearing loss from the audiogram that we do, how much energy is required at each frequency for them to just hear it, how much is required for a sound to be audible and comfortable, and how much sound is required to have it loud. We like to maintain the dynamic range of speech. So a soft sound will still sound soft. The loud sound still sound loud, and everything in between is calibrated, according to that range. And that's done for each of the frequencies throughout the spectrum. And this is what we call channels or frequency bands. And so they can do this digitally. We put the test results in the computer. The computer sets everything up, and then we can go back and tweak it according to their personal levels, comfort levels, and whatnot.
So I know there are several different types of hearing aids. Overall, what are the basic types of hearing aids?
There are all-in-the-ear hearing aids that are fabricated from an impression of the ear, and some of these are very small, some are a bit larger. A lot depends on the actual shape of the ear. There are behind-the-ear hearing aids. These are used to be the traditional hearing aid, and then it kind of merged into the in-the-ear hearing aids, which were more cosmetically acceptable to a lot of people. But now, with the digital revolution, we're fitting behind-the-ear open ear hearing aids. So there's no ear mold. It's just a speaker, maybe a little rubber dome on the end, goes in the ear, so that the low-frequency sounds that people hear naturally, they still hear them. There's nothing blocking the sound, but yet the hearing aid's there to provide that extra high-frequency emphasis for the consonant sounds that they're missing. It's very comfortable auditorily as well as physically. People really like them.
And what are the benefits of a completely in-the-ear hearing aid?
Depends on the size. The smaller ones, you still have the benefits of the effect of the pinna. The ears, your ears are directional, and you don't lose that if the hearing aid is in the ear. The behind-the-ear hearing aids are still directional, but it's not caused by the pinna effect, it's caused by electronic directionality. The larger in-the-ear ones are easier for some people to manipulate, because the small ones are hard for people to hold. They have smaller batteries, and some people just can't handle the tiny parts of the hearing aid. And so if people have dexterity problems, we'll recommend the larger, we call it a full shell or a half shell or a low-profile instrument. And it works well for a lot of people.
How about talking on the phone? Is it difficult with a hearing aid to press the phone up to your ear and hear conversations?
Some cases that can be a real problem, especially with the older hearing aids. A phone would make the hearing aid feedback or it would whistle a lot. The newer hearing aids have phone programs built in, and there's also Bluetooth features that can eliminate a lot of the telephone problems, where if they have a cell phone with Bluetooth on it, the cell phone can send the signal directly into the hearing aid, in both hearing aids at the same time. It'd be very easy, but you need a cell phone with Bluetooth.
So for folks that don't know, what is Bluetooth technology and how does it relate to hearing aids?
Bluetooth is a type of wireless communication from one device to another, and it's secure. It's not something anybody else can listen into, if they had the special receiver or anything. It's one device talks to another. So the cell phone gets a call. You have a streamer, which you can wear it around your neck. It lights up when you get a phone call. Your cell phone's in your pocket or somewhere like that. You don't have to take it out. Push a button and just start talking. And it's just like some people have this in their cars now. They take the call and the car becomes the hearing aid. It just produces the telephone message. You can also stream your TV, and they also have remote microphones. Say you're in a large gathering, you could put a microphone that clips on a lapel or something to somebody that's the other end of the room, and you'll hear them just like they're sitting right next to you.
So, and most people probably have heard of Bluetooth when it comes to phones, but that's interesting that they can use that technology also for television and some other devices as well, so that it's streaming wireless signals right into the hearing aid.
Right. So that they can regulate the TV volume that they're hearing differently from what the rest of the family's listening to.
When it comes to the technology of hearing aids, I would imagine that it's a lot different than it was 5, 10 years ago, 20 years ago. What are some of the new advances when it comes to hearing aids?
The new advances, you're right, they're a lot better, in my opinion, than they were 5 to 10 years ago. Directionality, the hearing aid itself is listening to the sound level in the room. And if it detects a certain amount of sound, and not only that, it detects the spectrum of the sound, whether it's a speech sound or whether it's just a random noise. Random noises will tend to be ignored, speech sounds will be reinforced, and then when the level reaches a certain point, the hearing aid will focus towards the front, so it's not amplifying side sounds, behind sounds any more than it should. That technology is still evolving. People are still complaining of background noise, and this has been the complaint ever since they first invented hearing aids, but it's a whole lot better than it used to be. And the processing of background noise, the ability of the hearing aid to know this is a speech sound, it grabs it, this isn't, ignore it, is improving all the time.
That's pretty amazing that device, it can make those adjustments on the fly so that folks with hearing aids can hear those sounds clearer. It's pretty amazing.
It is, yeah. It's truly an amazing technology. You've got an entire computer in your ear when you're wearing a hearing aid.
Great. Well, we're just about out of time, but before we go, any last words of advice for folks that may think they have early signs of hearing loss?
First thing, get it checked out. Go to your family physician. Make sure it's not some, just wax buildup or a middle ear otitis media or effusion in the ear, things like that need to be treated. And if it's not, if it's something that hearing aid will help, come in and talk to us. Minnesota law requires a 45-day trial no matter who's selling the hearing aid. So you can test them out, check it out before you make a commitment for a final purchase. So don't be afraid of them. Most people are very pleasantly surprised when we fit them, and they kind of say, I wish I'd done this a long time ago. And that's what I like to hear.
Great. Well, unfortunately, we're all out of time, but I'd like to thank our guest today, Dr. John Tunnell, audiologist from Mayo Clinic Health System. Thanks for joining us today on Speaking of Health.
Pleasure.
Have a great day, everyone, and be healthy.